So here's the scenario. Your patient just said to you, "I think life is not worth living anymore." Do you change the subject? Ask them why. Say, "Tell me more about that." Or call security and run and get a coffee. So let's clear this up. As psych nursing, your words are your intervention. And on the NCLEX, the right response isn't about fixing things. It's about listening with a purpose. So you ready to figure this out? Let's go. So what is mental health on the NCLEX? What are they testing you on? Well, the NCLEX wants to know, can you recognize mental health red flags? Do you understand how to communicate therapeutically? And can you keep your patients safe without violating trust and escalating the situation? Because it's not about having a psychological degree. It's about being present, empathetic, and knowing when to go get help. All right, so what are our therapeutic and non-therapeutic communication options? Well, let's break it down like a game show. Therapeutic, tell me more. It sounds like you're feeling. I'm here with you. And then yes, just be silent. You can just live in the moment with them. But what are the non-therapeutic options? Well, saying, "Why did you do that? Everything will be fine. You should, or at least it's not as bad as." So here's a tip for NCLEX. If the option includes advice, judgment, or dismantling feelings, it's probably the wrong answer. But here's a funny truth to remember. If your answer sounds like something that your know-it-all aunt would say at the Thanksgiving table, don't pick that. So what are some mental health red flags that you must know? Well, suicidal thoughts. Always assess plan, means, and intent. Homicidal ideations. Safety of others is the priority with dealing with this. And command hallucinations. These are the most dangerous. They told me to hurt someone. Now, new confusion or agitation, this could be psychosis, this could be medical. We always assess the patient first. So what are some of our high-yield psych disorders on the NCLEX? Well, schizophrenia. What do they experience? Hallucinations, delusions, disorganized thinking. But we have to stay calm, don't argue, and reorient gently. I understand that you hear voices, but I don't hear them, and you are safe. Watch out for depression. Red flags, sleep changes, anhedonia, guilt, suicidal ideations. Watch out for low energy, withdrawal, and suicide risk. Bipolar disorder is another one. How do we recognize it? Well, the manic phase is high energy, low sleep, and risky behavior. Reduce the stimulation, offer rest, and set limits. Now, anxiety disorder, teach deep breathing, muscle relaxation, and structured routine, very important for our anxiety patients. Now, you run into OCD, don't take away the rituals, at least immediately. We do a gradual reduction over time. And PTSD, watch out for the flashbacks and the hypervigilance. Provide a calm and predictable environment. So here's a few psych med tips that you can't miss. So, SSRIs, like sertraline. Watch for serotonin syndrome, agitation, confusion, and sweating. Lithium, it has a range. So if it has a range, it can have toxicity. So the range is 0.06 to 1.2, but toxicity equals tremors, confusion, and GI distress. Benzos, dependency risk, sedation, respiratory depression. And then antipsychotics, EPS, watch out for tumors and rigidity. NMS, fever, rigidity, and altered mental status. This is an emergency, but pay attention for these. So let's try out an NCLEX question. A client with schizophrenia says, "The CIA has installed cameras in my eyes. What is your best response?" That's not true. Why would they do that? You're having delusions. I don't see any cameras, but I understand this is real to you. Take a moment and pick your answer. In this case, the answer is D. You are reorienting, but without confrontation. That's therapeutic communication. So here's some nursing gold to remember. Psych nursing is 90% listening, 10% documentation, and 100% presence. You don't need to have the answers all the time. You just need to be in a safe place and assure your clients or patients are in a safe place too. Therapeutic communication isn't about having the perfect thing to say. It's about not saying the wrong thing. Stick with empathy, safety, and active listening, and you're going to crush this section. Next up, we deal with grief, crisis, and end-of-life care, because knowing how to support patients through the toughest moments, that's nursing. Great job. Go take a moment and do your exercises. I'll see you right back here for the next video.